school teacher for 20-some years. I was school administrator for about 15 years. I have 5 children. I have 11 grandchildren. So yeah, my plate is full. I am presently the director of programs, so again, that means I get the awesome privilege of traveling around to the other islands. And my plate is very, very full. But to those of you who are caretakers, there is none of our plates that compare to you, so we tip our hats to you, and lots of prayers that things will continue to go well for you.
Doesn't matter what happens.
Probably one of the most common questions that is asked is, what is the difference between dementia and Alzheimer's? Well, first of all, what I would like to establish is that dementia is kind of like you're just saying it's, if you compared it maybe to ice cream, that dementia is the ice cream, and there are other flavors of ice cream that you can have, but dementia is your umbrella, which is the one thing that is just basically telling you it's a condition in the brain that is resulting in memory loss, confusion, declining problem-solving, judgment skills, and language deficit. There are many diseases, traumas, things that's going on that would cause the dementia. There's medications that can bring on the dementia. But specifically what we want to discuss today is being Alzheimer's, and Alzheimer's is probably the one disease that causes about 70% of the dementia. Alzheimer's is a progressive brain disorder that gradually destroys a person's memory. It destroys their ability to learn, to reason, to rationalize, to make judgments, to communicate, to carry out what you and I would consider to be daily activities that just normally would happen, and we think it's like walking to them. It becomes progressively more difficult to do. As Alzheimer's progresses, individuals may also experience changes in their personality as well as their behavior, and things such as anxiety, suspiciousness, agitation, and even to some forms of hallucinations. And one of the challenges that you have is that while the Alzheimer's is progressively getting worse, sometimes there's also medications that is complicating the results of that. And again, Alzheimer's counts for about 70% of all cases of dementia. If you look up here on the screen, you see the brain of what would be of the normal elderly person's brain. It's full, it definitely has its ridges, which is what your brain, if it was cross-sectioned, would look like. But when the plaques begin to form and it begins to clog the brain is deprived of oxygen and nutrients that need to get there, and so what happens is the brain actually begins to shrink. And probably the most, the way to compare it to be something that you would understand is it's almost like a sponge. So not only does the brain shrink around the outside, but inside the holes get larger. So all parts of the brain is being affected. And as you know, when the brain is functioning the way it's supposed to function, information kind of goes from pocket to pocket to pocket. Different parts of the brain is also responsible for different functions of the body. So what happens is as the brain is shrinking, those functions and the processing ability also begins to go. So on the left is the brain of the normal elderly person. On the right would be the brain of an Alzheimer's patient. There are physical and emotional problems which can impact the behavior as well, and it's not all Alzheimer's, but it often will get misdiagnosed to perceive to be Alzheimer's. The effects of some medications can cause challenges, can cause dizziness, it can cause the inability to process information, can make someone very sleepy, very drowsy, can also make them highly agitated, so they're getting really grumpy. It can cause impaired vision or hearing, which at that point, when the vision and the hearing is impaired, it begins to block communication, so it makes it very difficult for that person to not only understand what they're being asked to do, but it also makes it very difficult for them to communicate what it is that they're wanting done. Having an acute illness, something that is coming up that could be anything from heart challenges to a simple headache, and this can all cause emotional problems which will impact the behavior. Chronic illnesses, again, would be in the same vein of the acute illnesses, and that is that these are all things that could be misdiagnosed with some form of dementia, but it's really not a disease that's causing it. It is a second characteristic of it. Dehydration can cause challenges probably a little more than you may realize. Someone who is dehydrated will find that they're getting very weak, having an inability to walk and walk into walls, fall over a table. In addition to that, it also slows down the processing, so when somebody is dehydrated, they're not always thinking clearly. Constipation, and with somebody who has dementia as well, they're not always able to tell you, I didn't go to the bathroom today. So for those who are caregivers, you kind of have to try to figure out if the dementia is being complicated because there are other things going on, such as constipation. Depression can also be a characteristic of somebody who is depressed, withdrawn. They would find it difficult to communicate, so it would, again, come across as a form of dementia. Fatigue, just being tired, not being able to sleep well at night. And again, the physical discomfort, being hungry, needing to use the bathroom, being hot, being cold. But somebody with Alzheimer's would not be able to tell you that that's what they're feeling because they're not able to define it for themselves. Environment problems, which definitely will impact behavior. If the environment is too large that the person is in, they just find it very insecuring, and it's too big, it's too large for them to operate in. Quite often a person with Alzheimer's or dementia find it more comforting to be in a smaller room. They also find it very securing to have less clutter around them, because what happens is when there's a lot of items and there's too much stuff in the room, they're not able again to process, to think, this is for this, this is for this, this is for this. And so what's happening is with too much clutter, it's too much thought, it's too much action required of the brain. When there is also excessive stimulation, there's too much noise going on, there are too many people talking at one time, the music is too loud. All of this again makes it very difficult for the brain to process whatever needs to be thought, and so it can be an element for agitation for the patient. As the brain shrinks, the person with Alzheimer's is relying on what their memory was or what they could think of before, not necessarily new things that they have learned in the last several years, but they are trying to operate on what they knew back then. You often find them talking about their childhood as if it is in the present. You often find them referring to their child as their brother or sister, but that is really their own child. And so what happens is they need information, they need cues. And sometimes just with mom, who always is wanting to put things away and she's so accustomed, you may need to put little labels on a door, or you may need to even put lines on the floor to direct them to a bathroom. There are certain little cues that they're no longer able to pick up, so you may need to assist them with finding their way around the house. Poor sensory environment, there's just nothing there that will stimulate them, and so what happens is it will cause behavior challenges if they don't have something to keep them occupied, keep them busy, and so that will often result in their agitation and getting upset easily. Unstructured environment. People with Alzheimer's will not function well in an environment that does not have a routine. They need to know that when the clock says it is 8 o'clock, we're going to have our breakfast. When it's 11:30, we will have our lunch. At 12:15, we will go for our walk. And what happens with this is quite often they will forget that they even had lunch. So you're able to go back and say, Dad, no, it is now 12:15. We had lunch at 11:30. At 12:15, we're going to put on our tennis shoes, we're going to take a walk. So you're able to keep the routine going for them. Unfamiliar environment is something else that does not work very well for the Alzheimer's patient because they are, again, secure with what is familiar. So what happens with the Alzheimer's patient who is brought into a new home, that's the, we always say, well, we want to bring Dad into our home because I can take better care of him, which is probably correct, and you probably have your reasons for needing to do that. But just understand that that could be an element of agitation because it's going to be an unfamiliar place for Dad. Task-related problems. If the task is too complicated, more than likely the task will not get completed. If it's too large of an undertaking, even though it is something that has been done repeatedly, Mom always made the Christmas cakes. Mom always made Christmas cakes from scratch. We bite into the Christmas cake and the cake was just, wow, what happened? And it's because Mom used 2 cups of salt instead of 2 cups of sugar. There are little things like that that you realize that it's just become too overwhelming and it's too complicated to do it. Too many steps combined. So you cannot look at Aunt Mary and say, Aunt Mary, go to the bathroom, put on your shoes, wipe your face, put on your t-shirt so we can close the door and go for a walk. Well, you lost her steps, and so what you need to do is break it all down. And when you're ready to do something, more than likely, you will need to repeat yourself several times in repeating the steps. The task is not modified for the increasing impairments because as Aunt Mary becomes progressive with the disease, she is less likely to even be able to put on her tennis shoes, much less remember to put the shoes on and the t-shirt. If it's an unfamiliar task, that is also something that can be very challenging for someone with Alzheimer's, and that's because what happens with this particular task is not only do they lack the ability to learn something new, but even what they knew recently, they don't remember it anymore because that part of the brain has already shut down. Problems relating to communication. The inability for them to understand what is expected of them, and quite frequently you will hear in a conversation in a home where, Dad, you know what I need, you know what come on, you know you're supposed to put on your shoes. No, Dad doesn't know what you need, Dad doesn't know to put on his shoes. You may need to say it quite a number of times with patience and gently, and keep your tones at a level that he will not misunderstand and hear your agitation, because that's just going to increase his anxiety. Inability to make themselves understood. I can't find my, I can't find my hand clock. Well, what are they asking for? They're asking for their watch. So you have to kind of listen to what they're saying. You have to put together their words, listen to their tone of voice, sometimes even asking them to give you a visual clue. Can point to me, show me what it is that you're looking for, show me a picture. So you have to kind of keep working with them to see if you can get them to brought to a place where they can make themselves understood. And there's some things you want to think about before you respond to them, because again, they're feeding off of your emotions and they're feeding off of the way you're talking to them. They will react to you the same way. So listen to your tone of voice, and you want to get down on their level, you want to speak to them with gentle tones, and you may need to again repeat yourself, and you're going to see this in the presentation a little later on. But when you repeat yourself, make sure you use the same words over and over. Don't think you need to rephrase what you're saying, because all you're doing is you're overstimulating the brain and you're giving them more information than they can deal with. Just repeat the same words. Dad, put on your shoes. in a few more minutes. Dad, let's get your shoes on. And he's just staring at you. Dad, put on your shoes. So you're repeating your words, and you're not, once you say, why aren't you listening? I told you already, put on your shoes. Once you do that, two things have happened. You lost Dad with your tone of voice, and secondly, he's going to try to think, what do you mean you said it to me already? I don't remember you saying anything to me. So you lost him on a tangent somewhere. So you want to make sure you just keep repeating your same words over and over. Things to think about before you respond: talk to the person in a place that is free from distractions. Because the more stimulation in the room, the more ability, or the more disability, I should say, they have of not being able to just zero in on you. So make sure you're speaking to them in a room that is free from distractions. Look directly at the person that you're speaking to. Make sure that you have their attention before you begin to speak. If Dad is looking at the ducks out the window, you might want to even just very gently, while you're talking to him, walk over, close the curtain. Dad, let's put on our shoes. Speak slowly and say individual words very clearly. Again, as the brain shrinks, it causes a processing challenge for them, and so you want to make sure that when you're speaking, that they can hear you and that they are able to have the time that they need to process what you're trying to say to them. Use very short, simple sentences. And I should also include here, use short, simple words. Because again, you're dealing with the process challenges. Ask simple questions that require a choice of yes, no answers. So don't try to ask them a question where they will turn around now and have to give you a complex answer. It ain't gonna happen. So you gotta make sure that when you're speaking to them, that you have worded things in such a way that they'll just say yes or no. When doing a task together, and by the way, this is something to the best of your ability, you want to try to always be doing tasks with them, because they, again, are looking for cues and clues, since they have lost a lot of their ability to process information and to know what to do next. They're looking at you to know what to do next. So when there are tasks that you can do together, that is the best for them. Try to focus on familiar skills or tasks. So if Mom is always walking around and you see her hands are going like this, or touching herself, or she's going like this on a table, say, oh Mom, you're doing that really good. Pick up her hand, put a white cloth underneath it, and just say, here, wipe the table for me. When she gets through wiping the table, good job, Mom. You know what, let's walk over here, let's do this table. Let Mom wipe that table. So you're doing something that is very familiar to her. In addition to, you're probably reducing some of her anxiety levels by finding something that has a motion in it that will help her to concentrate without needing to think about doing something else. Give choices. Mom, would you like to wipe this table or the bookshelf? So again, Mom is in control of something. Allow plenty of time for the information to be absorbed. So again, simple words, simple sentences, giving the information time to be absorbed. Repeat your instructions exactly the same way. Dad, put on your shoes. And Dad just stares at you. Dad, put on your shoes. Break down the task into very simple steps. So it might even get to the place where you would need to say, where you would need to pick up the shoe and say, put this on your foot. Modify the steps as the person becomes more impaired. Just be prepared to do more and more and more for the person as the time progresses. And always look, it's the same thing that we did with children when we're teaching them or when we're raising our children. We're always looking for them to be good. So the same thing you want to do with the person that you're caring for is you want to look for things that you can praise sincerely and tell them that they're doing a good job. When you are having trouble being understood, there's some things you want to take in consideration. You want to make sure that you are allowing them enough time to think. And in your mind, you may be thinking, oh, I already gave them enough time. Well, Obviously, you need to give them a little bit more time if you're wanting to be understood. So again, as a caretaker, it's exhausting. And your anxiety level and your blood pressure is going up. So you want to make sure that you are not, again, responding to them through your agitation. Keep yourself calm, keep yourself centered, and also make sure you're giving yourself time to talk correctly to where you will be misunderstood. And make sure that your motive is that you want to be understood. Because when somebody who has Alzheimer's, they can be stubborn, and they can be hard-headed, and you feel like you're dealing with a child, and sometimes you are dealing with another child. But you want to make sure that your motive doesn't get pulled into the power struggle, that your motive is to be understood so that you can give what is necessary for you to be understood. Try to demonstrate visually what you are saying. Now, I'm forever, you tie my hands, I can't talk, so I'm always going like this. But you may want to say, again, Dad, get your shoes on. So you're going to point to your shoes. Dad, where's your watch? And you can point to your watch. So again, you're not just telling something, but you're assisting them in what you and I have already assumed to be visual cues. I say watch, you automatically are probably thinking, oh, do I have mine on today? So you want to make sure that you understand that that part of their brain has diminished and you need to assist them with it. Think about the complexity of what you are saying. Perhaps it isn't so much that they need more time as much as it is that you need to be more simple in your requests. Try a hug. If you see that they're frustrated, if you see that they're just getting agitated and they're starting to pace and they go into that Alzheimer's stance where they're just marching and they're getting all agitated and all worked up emotionally, just say, oh, Dad, come here. Give them a hug, and you know what? I'm glad I'm with you today. There's nobody else I would rather be walking with. Take Dad to his chair. You may at that point need to help Dad put on his shoes. But you want to make sure that you can do what you can do in order to release his anxiety. When you are having trouble understanding, listen actively and carefully to what the person is trying to say. Now, I have a 17-year-old daughter. She's a senior in high school. My thing with her is, stop going by your feelings. Oh, you're so feeling-oriented. But, you know, it's kind of the reversal when we're dealing with somebody with Alzheimer's. We really need to zero in on their feelings because so often they cannot tell us exactly what is. So we have to look at how they feel, how they think, and it's a little more objective, but you need to listen actively and perhaps more objectively than you have before. Try to focus on a word or a phrase that makes sense to you or to them. Respond to the emotional tone of the statement. So if Dad is starting to whine, I can't get my shoes, he's just telling you he's frustrated. So you want to listen to the tone and you want to help him get his shoes on. Try to stay calm, try to be patient, and this is the one time that you want to put in big, huge words across somewhere, anywhere, probably everywhere in your house, is don't take it personal. So whatever's being done, whatever's being said by the patient, don't take it personal. Stay calm, be patient. Ask family members about possible meanings for what words, names, or phrases. So if you are the daughter and you are taking care of your father, sit down with your mom, have a hot cup of tea, a hot cup of coffee. Mom, you know, when Dad says, I can't think of something right now, about Don Baker, who's that? And she goes, oh, that's his friend he grew up with. They graduated from high school. They played football together. So, you know, maybe you're finding out that Dad has connected football and Don Baker together. You know there's no football player Don Baker, but now you know there is. So you're able to kind of walk into Dad's world and you understand what he's trying to tell you. Things you don't want to do. Don't argue with the person. Now, the reason we say don't argue with the person, it has absolutely nothing to do with the Alzheimer's patient. It's for your protection, because you're going to lose, okay? It's just bottom line. Argue with somebody who has dementia, you're going to lose. And so you'll never be understood, which means you're going to lose. So what's going to happen is you need to just, from get-go, well, I'm not going to let this go into an argument. But you're going to tell yourself that, not so much the patient. Don't try to order the person around. Dad, get your shoes on, now! It ain't going to happen, because Dad's again going to stick his feet in the ground and he's going to hear your tone of voice and there's no cooperation. Sounds like my 17-year-old sometimes. Don't tell the person what he or she can't do. Just try as much as you can instead of saying, no, you can't go out that door. Dad, let's go watch a movie. Look, there's a really good program. They're the whales, the orcas, they're on science station. Let's go see what's going on over here. So you're trying to redirect. And you're telling them what they can do, because they already feel powerless. They already feel demeaned. They already cannot, they know something is wrong. They can't tell you they know something is wrong, but they know something is wrong. And so what's happening with all of this is that they already feel like they're living in a trapped world. When you say, Dad, don't do that, you've just entrapped him more. So you want to tell Dad what he can do. Don't be condescending. Oh, you are so stupid. I'm so tired of this. And we're all, you're tempted to say that, I'm sure. But what you want to do is you want to pull back, center yourself, get yourself back where you should be emotionally, so that you can speak to the one you're caring for without you being condescending. They are still a person. They still have very strong feelings. They can't always tell you what they're feeling and what they're thinking, but it is still there. Don't ask a lot of questions that rely on a good memory. Dad, remember last week we said we're going to go today to Maui? And Dad still doesn't understand why you're just putting all this stuff in a suitcase, and he's asked you for the 5th time, why do we have a suitcase? Dad, remember we're going, no, Dad doesn't remember. Dad doesn't know, so you have to say it as if you had never said it before. Today we're going to catch the plane, we're going to fly to Maui. Don't talk about other people in front of them, it's very frustrating. Matter of fact, that's probably a really good policy for anybody, even if you're not with somebody who has dementia. Don't talk about somebody else in front of somebody else. But especially with somebody who has Alzheimer's or dementia, because number one, if you have very strong negative feelings about another person, it can also be transferred. They think that you're feeling that about them. So you want to make sure that you always keep your lines of communication open as much as possible. When verbal communication fails, try distracting the person. So again, it's Dad won't put on his shoes, he's watching the ducks out the window, so you want to distract him. You can distract him by very gently walking over, and while you're talking to him, just pull the curtain. Or you can even say to Dad, who's trying to go out the door and it's not the time to go out the door, oh, let's go watch the orcas, or let's go watch the whales on the TV right now. Ignore a verbal outburst. If you can't think of any positive response, just ignore it. It's probably the most difficult thing to do, because you want to say something back, you want to make sure that you're dealing with it, but you don't always have to deal with it. It's okay to let it go for the moment. If he's not hurting himself and he's not hurting other people physically, just let it go. Choose your battles. Try other forms of communicating. So again, even sometimes just reaching out and giving a hug helps to get Mom centered back to where she needs to be. 5 very common behaviors of someone with Alzheimer's or dementia: aggression, anxiety, confusion, repetition, and suspicion. What we want to do here is we want to talk about these areas, and we want to talk about what to do, what not to do when these become an issue. Aggression. Aggression can be shouting, it can be name calling, it can be swearing F word when the F word has never ever been a part of the vocabulary. It can be hitting, it can be pushing somebody up against a wall, it can be throwing an object, whether it be a book or a vase across a room. Physical hitting and pushing. How to respond to be effective would be try to identify the immediate cause. Try to find out again. Maybe they're in a room where they are overstimulated. Maybe there's too much noise going on. Maybe kids are running in and out, screaming and shouting, chasing each other, and it's causing Grandpa to become very, very agitated. Think about what happened right before the reaction that may have triggered the behavior. And again, you want to focus on feelings, not necessarily the facts. So, to look at Grandpa and say, oh, Grandpa, they're just children, they're just going to play. It doesn't matter if they are just children. It is something that is distracting for him, and obviously it is something that's causing a challenge in his feelings. Try not to concentrate on specific details, but rather concentrate on the person's emotions or the person's reactions to what's happening. Look for the feelings behind their words. So if Grandpa's looking at you and goes, oh, makes me angry, then deal with it, okay? So you deal with it. You help him to get into a space where he isn't getting angry. Even if you feel that Grandpa should not be angry about that, it's okay, it's his feelings, and that's your job as the caretaker to put him into a more centered position. Don't get angry, don't get upset. Again, big, huge words across the board. Don't take it personal, because it has really very little to do with you. Be positive, be reassuring. Speak slowly, speak in soft tones. Sometimes just speaking to someone in a certain manner will bring their anxiety back down to where it should be. Limit the distractions in the room. We talked about that one a little earlier. Examine the surroundings and adapt them to avoid other similar situations. Try a relaxing activity. Use music, use massage, exercise to help soothe the person who is agitated. Shift the focus to another activity, using distraction again. The immediate situation or activity may have unintentionally caused the aggressive response, so just try something different. The second one we talked about was the anxiety or the agitation of the patient. A person with Alzheimer's may feel anxious, may feel easily agitated over situations that have absolutely nothing to do with what you would think would cause agitation. And it may be something that you would not think would be causing that situation, but to them it is. They become restless, sometimes they need to move around, they'll start pacing, they'll become upset in certain places, they become very focused, obsessive about specific details of a situation or a home or a place or the room where they're at. They become over-reliant on a certain caregiver for attention and direction, become very possessive of that caregiver and never wanting to be out of that caregiver's eyesight, which means the caregiver is exhausted because they can't even go and pee without wanting that other person right there with them. So, you don't have your space as a caregiver, and so this is what happens quite often to the person with the Alzheimer's. How to respond as the caregiver? Listen to the frustration when they tell you that I don't want you to walk away from me. Say, oh, okay, I'll be right back. So just reassure them you're going to come back. But listen, I understand you don't want me to walk away. I won't leave you. Find out what can be causing the anxiety, try to understand, provide the reassurance using calming phrases, let the individual know that you're there for them or for her. And it is, again, it's very much like what you would do if you were in your own office and you were having a talk down with somebody who came in and they were agitated, and you would say, you're not going to use all these words to the person with Alzheimer's, but to the person in your office, I understand that situation must have made you very upset. Now let's see what we can do to work this out together. So with the Alzheimer's patient, it is good to reflect that. It's good to look at them and say, that made you angry. Or if they're crying, that hurt you. So you're affirming to them and you're letting them know that you do understand what it is that they're going through. Involve the person in activities. Try using art, music, other activities to help the person relax. Sometimes just taking them for a walk, getting them out of the house will help in that situation. The third one on the list was confusion. The person with Alzheimer's may not recognize who you think are familiar people, familiar places, familiar things. Dad, that's your grandson. That's John. You know John. No, Dad doesn't remember that's his grandson. So you need to remember that Dad doesn't remember. It's no longer familiar to them. They forget relationships. They will call family members by names other than what they are. It is not uncommon for an older person to refer to their daughter as the name of what their sister was, because the daughter looks very much like their sister did. And so they're going back in time, and they become very confused with where home is. I want to go home. Mom, you are home. No, I want to go home. Mom, you are home. So mom doesn't remember any longer that this is her home. So if you ask her or show pictures where home is, she'll tell you that's home, because that was her childhood home. How to respond? Offer corrections as suggestions. So you don't say, Dad, you know, that's your grandson. You know your grandson. Instead of saying that, say, Dad, this is your grandson, John. So you're going to introduce John as if Dad had never met him before. Avoid explanations that sound like scolding. If Dad picks up a knife and is trying to eat with a knife, simply, instead of going, Dad, you can't pick up the peas with a knife. Just pick up the fork or the spoon, place it in Dad's hand and say, try this, it might help you. So you're not scolding, you're not being condescending. Respond with a very brief explanation. Don't overwhelm them with lengthy statements and reasons, and instead clarify with a very simple explanation. I don't know how you think you can pick up the peas with a knife. You know they're just going to fall right over the side, and when you put the knife in your hand, you can't even control the knife. And Dad's just staring at you because he has no idea what world or what planet you're living on, okay? So, very simple. Dad, try the fork, it might work better. Dad, try the spoon, this might be better. Show photos and other reminders, so when Dad doesn't remember that John is his grandson, later on you can bring out the album and you can show him pictures of John being a baby. Use photographs, thought-provoking items to remind the person of important relationships and important places. Number 4 on your list, you had repetition. Now, that's probably the most common element, is knowing that Mom repeats herself over and over. Why am I putting on my shoes? Mom, we're going to go walking. How come I have my tennis shoes on in the house? Mom, we're going to go walking. Why are you making me wear my tennis shoes? Mom, we're going to go walking. So you're just being very calm, you're being very patient, and you are also able to just keep affirming Mom and what it is that she's needing, because she doesn't remember, she's not connecting it yet. A person with Alzheimer's may do or say something over and over, asking a question, repeating the same activity. In most cases, they are probably looking for what is familiar to them. They're trying to find something that they can connect to, and they just haven't found it yet, and they keep repeating a behavior or a word, trying to find the familiarity. The person will also pace or undo what has just been